Hi, thanks for joining again. My name is Stefan Maar. I'm an expert on treating trauma, war-related PTSD. And today we have my patient Bill. He is my patient for quite some time now, and maybe share some experience with other veterans out there, or their wives, or their friends or relatives who are interested in how to treat war-related PTSD. What are the possibilities? What are symptoms? What are the ups? What are the downs of war-related PTSD? And today we want to talk about a very serious question. It's the feeling of guilt. And feeling guilty, I think, is not a pleasant feeling. So thanks for being here, Bill, again, and sharing your experience, which I'm sure it's not super easy, but yet thank you anyways. And you said once that the American veterans often feel like a big family.
Yeah.
And I think sharing experience with family members is always a good thing.
Yeah.
So when I talk about or ask you feelings of guilt, or maybe even feelings of shame, what comes up in your mind?
Well, I mean, the guilt part is, what kind of things could I have done differently? On kind of both sides. On one end, soldiers that were lost, friends that were lost, stuff like that.
Yeah, during the war, obviously.
Right. Well, during the war and afterwards.
Afterwards.
To be honest, let's be transparent here. I've lost more friends outside of the war to suicide than I did fighting in Iraq.
Yeah, that's a very serious thing. Thank you for bringing it up. It's very uncomfortable, I would say, or very sad story that I think there's a statistic out there that 28 American veterans that are...
22.
Is it 22?
22 did.
I'm sorry, 22. There is a statistic out there of veterans that commit suicide. And so I don't know, but I think the risk of getting anywhere near that, heaven forbid, is lower doing regular therapy. So I'm trying to say therapy and medication where it's needed. What is your opinion on that, your experience?
Yeah, look, it's about talking to people.
Yeah.
Right? That's every time, we get another notification, whether it be on Facebook or whatever else. Most of us stay together on Facebook or Instagram, and we hear about, another buddy who committed suicide, where just the week prior he was posting how great his life was. It goes back into that, wearing a mask.
Really?
Right? Just everybody,
thought, totally different story, basically.
Totally different thing, and then, we hear about it. And every single time everybody says, look, if you're getting to that point, pick up the phone, call, and that's the truth. Pick up the phone and call.
Yeah.
But I found that, while we think that the only people who can really understand us are the people who's been there through the shit with us and everything else like that.
Yeah.
The reality of it is there's people like you, who haven't lived through it.
No.
But they understand how to listen, and then to give us tools to cope with that kind of stuff, right? The guilt, the shame, all that kind of stuff, it's really the same things that you get awards for, the same things that you're, quote unquote, a badass for. Those are the same demons that I'm at least dealing with. I don't know about anybody else, but for me, it's the same stuff that you were a badass in the Army.
Yeah.
Those are the things that keep you awake at night, and those are the things that keep you, the regrets per se. Not so much of, the actual actions that you've done, but what could you have done besides that, right? In this situation, you do what you have to do. I'm not sad about that. But realistically, it takes a piece of you.
Well, let's put a pause, if I may ask you that, because I think we have to take a second part of this very, I think, interesting and important topic. So join in to the second part of this video right after this. Thank you for watching.